Good evening, guys. This is B for you. It's discussion B. It's discussing the final moments in hospice care. For those of you who don't understand what hospice is, I'm going to go through this presentation for you. So here we go. The final moments in hospice care. Hospice workers regularly witness mysterious phenomenon as patients near death, things that challenge conventional expectation or explanation. Okay. The article explores 30 unique occurrences ranging from visions of deceased loved ones to reports of unseen visitors and moments of profound peace. These experiences are shared through first-hand caregiver accounts, highlighting emotional, spiritual, and sometimes inexplainable or unacceptable moments that accompany the end of life transitions. Science versus mystery. While some of these phenomenon are interpreted spiritually or metaphysically, medical science offers potential explanations tied to neurological shifts, oxygen deprivation, and psychological coping mechanisms. Despite research, many moments remain beyond full scientific understanding, capturing the deeply personal and sacred nature of dying. It's a fascinating look at the delicate intersection of life, loss, and human experience. If you're interested, I could explore how these observations might align with memory friendly or dignity focused end of life models you're investigating. End of life experiences are shaped by a rich tapestry of psychological factors that influence how individuals perceive, process, and cope with dying. Here's a breakdown of the most impactful ones. Cognitive and emotional factors, fear of the unknown, anxiety about what happens after death or the dying process itself can heighten emotional distress, denial, and acceptance. These are parts of the psychological journey, often described through models like uh, Kubler Ross's 5 stages of grief: denial, anger, uh, bargaining, depression, and acceptance. Sense of control, feeling empowered through advanced directives or end of life planning can reduce anxiety and foster peace. Social and relational influences. Support networks, strong relationships with family, friends, or caregivers can buffer psychological distress and foster meaningful or meaning making. Okay, unresolved conflicts, lingering interpersonal tensions may intensify emotional suffering or complicate closure. Cultural norms, societal attitudes toward death, whether taboo or openly discussed, shape how individuals approach dying. External, extern, ex, existential, and spiritual dimensions. Search for meaning. Many individuals reflect on legacies, purpose, and spiritual beliefs, which can either comfort or challenge them. Okay, give me 1 second, guys. Transcend transcend experiences. Reports of visions, dreams, or terminal lucidity often carry psychological significance, offering peace or closure. Spiritual distress. When beliefs are questioned questioned or unmet, individuals may experience external anxiety, developmental and personal history, age and life age and life stage. A young adult may struggle with unfinished life goals, while an older adult might reflect on life satisfaction. Previous experiences with death, past losses, whether peaceful or traumatic, can shape current attitudes and coping mechanisms. Mental health history, pre existing conditions like depression or PTSD can amplify psychological suffering. Clinical, clinical and environmental contexts. Nature of illness, sudden versus prolonged. Okay. Illness affects psychological adjustment. Terminal diagnosis often prompt anticipatory grief. Quality of care, Compassionate communication and palliative support can ease psychological burdens. Settings of death: home, hospice, or hospital environments influence emotional comfort and perceived dignity. Aware care models, especially in designing environments that support emotional resilience and dignity. They shape they shape palliative care in profound and practical ways, especially when care models aim to preserve dignity, autonomy, and emotional resilience. Here's how here's how those psychological factors ripple through practices. Personalize Personalization of care, emotional and cognitive assessments, guide tailored interventions such as using CBT for anxiety or life review therapy for external distress. Spiritual and cultural beliefs influence rituals, communication styles, and decision making preferences, prompting culturally responsive care, creating safe and supportive environments. Fear, trauma, and unresolved grief are addressed through trauma informed approaches, which reduce emotional suffering and improve trust in care teams. Protected environments, whether inpatient or home based, enhanced or enhance psychological well being by fostering safety and familiarity, guys. Mindfulness, relaxation techniques, and psycho education are integrated to manage pain and emotional distress, strengthening relationships and communication. Family dynamics and caregiver stress are actively supported through counseling, education, and shared decision making frameworks. Psychologists and social workers often mediate complex conversations, helping patients and families navigate care transitions and legacy planning, informing ethical and clinical decisions. Mental health history and external concerns. With advanced directives, hospice enrollment, and life extending treatments, autonomy and dignity are preserved by aligning care with patients' values, especially when cognitive decline or frailty complicates communication. And if you'd like, I can explore how these insights could be woven into memory friendly housing or frailty aware models, especially those you're evaluating for smart environments or caregiver training. Want to dive deeper into that? Home based palliative care brings those psychological and relational principles directly into the patient's living space, transforming the home into a sanctuary of comfort, dignity, and personalized support. Here's how the practices you asked about are applied in this setting. Personalization in the home environment. Care plans are tailored to the patient's goals, values, and cultural background, often incorporating legacy work, spiritual rituals, and or memory friendly design elements. Advanced care planning happens in familiar surroundings, making decisions about end of life preferences more grounded and less intimidating. Okay, then you've got interdisciplinary team support. Mhm. Teams typically include nurses, physicians, social workers, chaplains, and aides who visit regularly to manage symptoms, provide emotional support, and educate caregivers. Mental health professionals may offer CBT, mindfulness, or trauma informed care to address anxiety, grief, or external distress. Psychological and emotional well being, routine assessments of emotional state, coping capacity, and caregiver stress guide interventions like relaxation techniques or psychoeducation, terminal lucidity, or spiritual experiences are acknowledged and give me 1 second, guys. Supported often with chaplain involvement or narrative therapy, ethical and clinical decision making. Shared decision making frameworks are used to align treatments with patient values, especially with cognitive decline or frailty complicated communication. Home based models allow for nonsense decisions about hospice transition and curative treatments or comfort focused care, caregiver empowerment, and education. Caregivers receive training in symptom management, emotional support, and self care, often through interactive methods or telehealth check ins. Give me 2 seconds, guys. Gotta straighten these up so I'm not so stiff. Respite care and volunteer support help reduce burnout and foster relational resilience. Technology and access. Many programs use electronic health records, telemedicine, and remote monitoring to coordinate care and ensure continuity. Smart housing adaptations like ambient assisted living systems can be integrated into support autonomy and safety. If you'd like, I can help map these practices into the smart housing care or caregiver training models you're developing. Or we could explore how frailty aware frameworks adapt these principles for more complex cases. What direction feels the most useful right now? Technology is reshaping home based palliative care by making it more personalized, accessible, and emotionally supportive, especially for older adults and those with complex needs. Here's how it here's how it's making meaningful differences. Symptom monitoring and management. Wearable devices like Fitbits and bracelet sensors track vitals, heart rate, sleep activity to detect distress early. Electronic infusion pumps help manage pain with precision, reducing hospital visits. Multiple apps allow patients to log symptoms and receive real time feedback from care teams. Communication and collaboration or coordination. Telemedicine platforms enable virtual visits, reducing isolation and improving access to specialists. Secure messaging systems streamline communication between patients, caregivers, and clinicians, enhancing continuity of care. Electronic health records ensure seamless data sharing across interdisciplinary teams. Emotional and psychological support. Virtual reality is used for guided meditation, travel simulation, and pain distraction, improving mood and comfort. Online support communities and interactive platforms foster connections and reduce loneliness. Caregiver empowerment, remote training models, and telehealth check ins help caregivers manage symptoms and practice self care. Smart, smart housing adaptations like ambient assisted light or ambient assisted living systems support autonomy and safety for patients with frailty or cognitive Decline, equity and access, digital inclusion strategies, simplified interfaces, low cost devices. Help underserved populations benefit from tech enhanced care. Telepalliative care bridges geographic gaps, allowing patients to receive dignified care at home, even in resourced limited areas. Would you like to explore how these technologies could be integrated into memory friendly housing or frailty aware care models you're evaluating? I can also help map out ethical considerations or training frameworks for caregivers. Technology in palliative care opens remarkable possibilities, but it also introduces complex web of ethical considerations and demand thoughtful navigation. Issues. Here's a breakdown of key issues: autonomy and informed consent. Digital tools must respect patient autonomy, especially when cognitive decline or emotional distress complicates decision making. Informed consent becomes more nonsense with smart devices, remote monitoring, and AI driven recommendations. Patients must understand what data is collected and how it is used. Privacy and data security. Sensitive, sensitive health data from wearables, apps, and telehealth platforms must be protected from uh, barriers or misuse. Ethical dilemmas arise when balancing data sharing or care coordination with the patient's right to confidentiality, equity, and access. Digital devices can exclude marginalized populations from tech enhanced care due to lack of internet devices or digital literacy. Ethical care models must ensure that technology doesn't widen dis, uh, disparity, disparities in end of life support. Algorithmic bias and decision making. AI tools must make AI tools must or may reflect bias in training data, potentially skewing symptom prediction of care recommendations. Transparency and accountability are essential when algorithms influence critical decisions or resource allocation. Okay, emotional and relational impact. Over reliance on technology may reduce human connection, which is vital in palliative care. Ethical tension exists between efficiency and empathy, especially when virtual tools replace face to face interaction. End of life autonomy and control. Smart systems that automate medication or monitor stress must align with patient values and preferences. Ethical frameworks are needed to guide how much control technology should have in end of life scenarios. If you'd like, I can help you explore how these ethical concerns intersect with memory or caregiving training programs you're evaluating. Uh, would you like to map these issues onto specific tech enhanced innovations? Okay, guys, so that is B for you. I'll be jumping back on in a little bit for C. I'm going to go take a little break and I'll be back with you for C shortly. For now, Gator Wellness, take care, folks.